Carotid artery disease is a condition where plaque builds up inside the carotid arteries, which supply blood to the brain. This can reduce blood flow and increase the risk of stroke, which is the fifth leading cause of death and a major cause of disability in the United States. Traditionally, there are two main options to treat carotid artery disease: carotid endarterectomy, CEA, and carotid angioplasty and stenting, CAS. CEA is a surgical procedure that involves making an incision in the neck and removing the plaque from the artery. CAS is a less invasive procedure that involves inserting a catheter through a small puncture in the groin and placing a stent inside the artery to keep it open. However, both CEA and CAS have limitations and risks. CEA requires general anesthesia, which can be risky for some patients, and can cause nerve injury, bleeding, infection, and heart attack. CAS requires the use of a filter device to catch any debris that may break off from the plaque during the procedure, but this device can also cause damage to the artery wall or embolize debris to the brain. Silk Road Medical has pioneered a new approach for the treatment of carotid artery disease called TransCarotid Artery Revascularization, TCAR, that combines the protection of surgery with the benefits of a less invasive procedure. TCAR is performed through a small incision at the base of the neck, which allows direct access to the carotid artery. A special device called the ENROUTE Transcarotid Neuroprotection System is inserted into the artery and connected to a tubing system that reverses the blood flow away from the brain. This creates a protective zone that prevents any plaque debris from reaching the brain and causing a stroke. Then, a stent is placed inside the artery to restore normal blood flow and prevent future plaque buildup. The procedure is completed in less than an hour and does not require general anesthesia. TCAR has been proven to be safe and effective in clinical trials and real-world studies. It has been shown to have a low stroke rate comparable to CEA, but with a lower risk of heart attack, nerve injury, and hospital stay. It also has a high patient satisfaction rate and a fast recovery time. TCAR is covered by Medicare and most private insurers for patients who meet certain criteria. TCAR is a revolutionary procedure that offers a new option for patients with carotid artery disease who want to reduce their risk of stroke without undergoing major surgery or exposing themselves to potential complications. If you or someone you know has carotid artery disease, talk to your doctor about whether TCAR is right for you. TCAR stands for TransCarotid Artery Revascularization, a minimally invasive procedure that treats carotid artery disease and reduces the risk of stroke. TCAR is performed by Silk Road Medical Inc., a company that is dominating the field of carotid artery treatment. But how do we know that TCAR is safe and effective for patients with carotid disease? Well, there is a large and growing body of clinical evidence that supports TCAR as a less invasive alternative to the traditional surgery called carotid endarterectomy, CEA. One of the most important sources of evidence is the TCAR Surveillance Project, TSP, an initiative of the Society for Vascular Surgery Patient Safety Organization, SVSPSO. The TSP is a surveillance registry that monitors the outcomes of more than 20,000 patients who have undergone TCAR in over 300 centers across the U.S. The TSP has shown that TCAR has been proven to be safe and effective for both high-risk and standard-risk patients, with low rates of stroke, heart attack, nerve injury and hospital stay. Let's look at some of the key findings from the TSP. First, TCAR has demonstrated a consistently low stroke rate of 1.4% in high-risk patients and 0.9% in standard-risk patients. This is comparable to or better than the stroke rate of CEA, which ranges from 1.2% to 2.3% depending on the patient's risk profile. Second, TCAR has shown a low rate of heart attack of 0.7% in high-risk patients and 0.4% in standard-risk patients. This is significantly lower than the heart attack rate of CEA, which ranges from 1.1% to 2.7%. Third, TCAR has achieved a remarkable reduction in nerve injury compared to CEA. Nerve injury is a common complication of CEA that can cause permanent disability and affect the patient's quality of life. TCAR has reduced nerve injury by ninefold, from 2.7% in CEA to 0.3% in TCAR. Fourth, TCAR has enabled shorter hospital stays and faster recovery for patients. The average length of stay for TCAR patients is 1.3 days, compared to 2 days for CEA patients. Moreover, 85% of TCAR patients are discharged home, compared to 67% of CEA patients. These results are impressive and consistent across multiple studies and trials that have evaluated TCAR's safety and effectiveness. For example, the Roadster 1 and Roadster 2 trials have confirmed that TCAR has low rates of stroke and death in high-risk patients. The PROOF trial has shown that TCAR has non-inferior outcomes to CEA in standard-risk patients. In summary, TCAR has been proven to be safe and effective for both high-risk and standard-risk patients, with low rates of stroke, heart attack, nerve injury and hospital stay. TCAR is a less invasive procedure that offers multiple benefits for patients with carotid disease. Silk Road Medical Inc. is leading the way in providing this innovative solution that can save lives and prevent strokes.